Hi, I wanted to make a video on asthma in 5 minutes or less, just because this is a big one that's going to be on our test of the 70 points. So quickly, what is asthma? It's a chronic inflammatory disorder of the airways. So with that, you see inflammation and bronchospasms. Those are the two big things that you see in asthma, and that's from the narrowing of the airways. And you see the IgE antibody that comes into play, because remember, IgE is part of that inflammation process, so you're going to see a hyperactivity of it. And so if your patient comes in and they're having inflammation and bronchospasms, what symptoms are they going to present with? They are going to come in with a cough, a wheeze, shortness of breath. They might have chest tightness. They might have tachypnea, tachycardia. And remember, when you're having trouble breathing, I mean, that is very scary for the patient. So they might also present with anxiety. And so that just kind of goes back to when you think of inflammation of the airways, you're going to see that edema, so that closing of the airways, and it makes it hard to breathe. So how are we going to assess our patient? So we can do a CBC, look at like white blood cell counts. We can do an allergy test, where you poke and you see what they might be triggered by. There's a lot of different tests you can do, but the most important one is the peak flow expiratory test. And I remember that like a stop sign, because with that, the green 80 to 100%, that is considered a perfect score. That is the best you can get. And I always remember green, go. So that is a good score. Yellow is 50 to 80%. So that's more of a caution, be careful. You just have to be, kind of look at their treatment plan and if it's working for them. And then red is less than 50%. That is stop. We need to administer a bronchodilator ASAP, because obviously they're having a lot of trouble with breathing. So again, that peak flow expiratory meter is what they're gonna assess the patient with to see if they're managing it well, and just how much difficulty they are having. So what risks does a patient have? Like what will, the risk factors for asthma. So genetics, environment, think of if they're around pollutants, the air, if they're like a lot of pollution in the air, their obesity, if they have obesity, a premature birth weight, smoking, remember it causes that vasoconstriction, and allergens. So for example, my mom, if she goes out into the woods and she comes back, she has those runny eyes and she can't breathe. She kind of, she has a horrible allergy to, I don't know if it's trees or what, but something. All right. So if a patient is having trouble breathing, this is a big thing that I think we're going to have to know for the test. What treatment options are we going to do? So the first line of defense is a beta-2 agonist, and that is a bronchodilator. We're going to want to use our bronchodilators first. So albuterol is for acute. I always remember that because they're both A. Albuterol, acute. So that's a beta-2 agonist, and these are short-acting, so they're quick. They're the things you want to use in an acute situation. Ipratropium, that's another medication that you can use if the patient doesn't respond to beta-2 agonists, or you can use it with it just to help the therapeutic effect. So these are both short-acting. And then theophylline, which is a LABA, that's a long-acting beta agonist. That's more used to prevent asthma attacks. It's not used for acute situations. And then finally, a meter dose inhaler and a dry powder inhaler. Those, a patient can use on a daily basis, but you have to remember they have to have good oral care, because that can cause like thrush and just other problems. So it's important for them to, wash their mouth out and brush their teeth, and yeah. So finally, there's a few different meds that are used for that inflammation, but the biggest one to remember is this is our first line of defense for inflammation is inhaled steroids. So fluticasone, that is used for prevention and management of the symptoms. The other meds on our sheet are just for prevention, they're prophylaxis. So that's asthma in 5 minutes or less. Good luck.